Hi, this is Dr. Jonas Liebowitz, an endocrinologist with 30 years of clinical experience, here to talk to you about hemoglobin A1C. What is hemoglobin A1C? You may hear about it when people tell you about their sugar results, or a doctor may ask you, what is your hemoglobin A1C? And it is a very important test, probably the most important test in evaluating, diagnosing, and following a diabetes patient. The hemoglobin A1C is a blood test that could tell us what a patient's sugar average has been for about a 90-day window of time. And it's done by a simple blood test, and it has names where you may call it an A1C test, or you may call it the HbA1c, or some people may even call it a glycated hemoglobin, which really is just telling you the sugar that's stuck to hemoglobin, which are the blood cells, the cells that carry oxygen around our body. And that's exactly what that test tells us. How much sugar is stuck to the blood cells. And since blood cells live about 120 days or so, roughly we're getting a 90-day average of the sugar based on the life of different blood cells and some other scientific issues. So it's a 90-day sugar average. How can we use it in day-to-day practice? Well, you use it to diagnose diabetes. If the A1C is 6.5 or higher, you're a diabetic. Usually you want to confirm that at least once. It's a good way to tell how patients are doing with their treatment protocols. If you start them on a medicine, you may follow that test over time. And it's also a good way to know how someone is doing who may not know much about what their sugar results are. Perhaps someone in the hospital who hasn't been doing finger checks at home, and when they come in, you want to get an idea of what's been happening at home, or the same type of thing in the office setting. It's a good way to know where someone is with their sugar control over time.